If something went wrong with your heart, would you know it? Not all heart problems come with clear warning signs. Chest pain has been considered a universal symptom of heart attack for a long time, but research has proven that the symptoms aren't always so clear. That's especially true if you're 60 or older, have diabetes, have high cholesterol, are overweight, or have high blood pressure. Around 9% of women and 11% of men in the UK have been diagnosed with heart or circulatory disease. Understanding early symptoms that may indicate a heart attack can help you determine when to seek medical care. Today's video will talk about 10 early warning signs that could mean it's time to seek medical attention. Number 1. Chest pain. Chest pain is the classic sign of heart disease. If you have a blocked artery or have a heart attack, you may feel pain, tightness, or pressure in your chest. People often describe it as an elephant sitting on them. Other people say it's like a pinching or burning sensation. The feeling usually lasts longer than a few minutes, and it can happen while you are resting or doing something physical. Also, keep in mind you can have heart problem without chest pain, and that is particularly common among women. Number 2. Extreme fatigue. If you suddenly feel fatigued after doing something you had no problem doing in the past, like carrying groceries from the car or climbing the stairs, make an appointment with your doctor right away. But if you are tired due to working hours or staying up late, it's probably not your heart to blame for. Number 3. Swollen ankles. If your ankles get big, they can be a heart failure marker. It is a sign that your heart doesn't pump enough blood as effectively as it should. When the heart can't pump strong enough, blood backs up in the veins and causes bloating. Heart failure also makes it harder for the kidney to remove extra water and sodium from the body, leading to bloating. Number 4. A cough that won't stop. Cough isn't a sign of heart problem in most cases, but if you have heart disease or know that you're at a risk, pay special attention to the possibility. If you have a prolonged cough that produces white or pink mucus, it could signify heart failure. And this is because the heart can't keep up with the body's demands, causing blood to leak back into the lungs. Number 5. Feel dizzy or lightheaded. You may feel dizzy because you didn't have enough to eat or drink, or you stood up too fast. But if you suddenly feel unsteady and you also have shortness of breath or chest discomfort, it could mean your blood pressure has dropped because your heart cannot pump the way it should. Number 6. Snoring. It's normal to snore a little while you sleep, but unusual loud snoring that sounds like choking or gasping can signify sleep apnea. And that is when you stop breathing for brief moments several times at night while you are still sleeping. This puts extra stress on your heart. Number 7. Arm pain. Another classic heart attack symptom is a pain in your arm. If pain is going down the arm, especially the left arm, or into the neck, it is more likely to be heart-related than indigestion. Number 8. Nausea, heartburn, or stomach pain. You can have an upset stomach for many reasons that have nothing to do with your heart, but some people have these symptoms during a heart attack. Women are most likely to report this type of symptom than men are. Number 9. Throat or jaw pain. Throat or jaw pain is more likely caused by a muscular issue, a cold, or a sinus problem. But if you have pain or pressure in the center of your chest that spreads up into your throat or jaw, it could signify a heart attack. Number 10. Irregular heartbeat. It is normal for your heart to race when you are excited or nervous. Usually, it is caused by something easy to fix, like not enough sleep or too much caffeine. But if your heart is beating out of time for more than just a few seconds, it could signal a condition called atrial fibrillation that needs treatment. Remember, this video is for educational purposes. We are not giving you medical advice. You should always consult your doctor if you need any professional opinion. Did you find this video helpful? If yes, then make sure to like this video, subscribe to our channel, and hit the bell notification button to view more upcoming Create Cure content like this.